What is the current state of board and cares?
Board and care services, from what I understand, were either designed or flourished during the time that the state mental health bed hospitals were being closed down. The idea that was that people could move to the community, they didn't need the hospital care that they received, and they'd be able to live in these kind of semi-protected but open facilities. And that did work. I mean, there were a lot of people that did come. That's where they went to when they shut down the state mental health facilities. As time has gone on, there's been an evolution in the philosophy of care towards much more, less of a victim or a sufferer of mental health than the challenge that, hey, you've got this problem. Maybe it could be diabetes, but you're going to have to manage it. You're going to have to, come to the plate, figure out what to do, and then you can have a life. You can have friends, you can have hobbies, you can do all sorts of things, work. But that wasn't the original thought. The system said, a major mental illness, you'll probably never work, you're probably caretaking for the rest of your life, etc. And people fought to make that not the plan. We actually, the Alcott Center started in residential care sometime in the 70s, and so therefore we never completely let go of it. Oh, the payment for residential care services has not kept up with the actual payment care, and I think that it's been because it hasn't been advocated and because they're not in the current philosophy, it's been allowed to die on the vine. Many facilities have gone from being licensed by residential care, which is the state office, to becoming boarding houses because they couldn't afford it. I mean, it's $30 a day for residential care to provide that. You have to be a larger facility for it to have any economy of scale. And this is for folks on SSI. And, I have cats. I could board my cat for more than $30 a day. So it doesn't make any sense. And there's been no increase in the rate for the last 3 years. And it certainly hasn't kept a pace with the cost of living.